Hi, my name's Tara Whyand. I'm a dietitian specialising in neuroendocrine cancer, and today I've been asked to speak about myth busting and research needs in nutritional care. So, the whole point of today really is to raise awareness of the common diet and neuroendocrine cancer myths. I also want to highlight the gaps and the funding within research within our area. And before I go through the presentation, I just want you to bear in mind 2 points throughout the presentation. So first of all, diet myths and cancer myths are usually related in some way to something causing cancer. And what I just want you to bear in mind that the nutritional factors which are linked to causing cancer are completely separate to the nutritional considerations that we have during cancer. Today, I really am just talking about nutrition once you're diagnosed with a neuroendocrine cancer. The second point, just to bear in mind, is often people take ideas from other cancers, for example, prostate cancer and breast cancer, and they relate their dietary changes and the studies that have been shown in those cancers and bring them over to neuroendocrine cancer. However, if we don't have research for our specific group of cancers, we can't really just easily translate that. So what's true for one cancer may not always translate over into neuroendocrine cancer. So first of all, I thought I'd tackle the most popular myth, the one that's dragged through the internet, comes up all the time, has got lots of books written about it. And it really is the thing that probably annoys us most as dietitians and doctors and nurses, because we get it all the time. So basically, the theory that came up sometime last century, it's quite old now actually, is that cancer cells feed on sugar, and if you eliminate sugar from your diet, which is pretty much impossible, then it will starve your cancer, and your cancer will go away. And you'll have seen mad stories about cancer going away and someone's cut out sugar. So the first thing just to address is that you can't starve your body of sugar. If you do, that means eliminating all the fruit, all the veg, all the added sugar. You don't need that anyway, but it means eliminating all the starch, potato, pasta, all of those kind of things. And so if you eliminate all carbohydrate, because starch does break down into glucose, eventually you will die. So it's actually just not possible to do it. And also, lots of people have weight issues. So if you're reducing one of the 3 sources of calories, reducing carbohydrate will make you lose weight. And obviously, lots of people don't want to do that when they're trying to maintain it, and they find that quite a struggle. So one of the other things that has kind of cropped up more recently is the concept of should I try a ketogenic diet? I've heard lots of good things about ketogenic diets, and more so kind of recently, people have asked about this. So the basis is that you're pushing your body into making ketones. You have a higher fat level, lower carbs, and higher protein. And it's been used quite successfully, especially in children with epilepsy and controlling seizures. And for the same reasons, it's now being trialled in brain tumours. However, we don't have any trials in neuroendocrine cancer. So we can't really say that it works at all. So at the moment, I wouldn't be using it. And I think we really need to wait for someone to get a trial going, or a couple of trials, to be honest, to make sure that there's any point. Obviously we don't see seizures as a common side effect of neuroendocrine cancer. So it would be whether that would help the cancer growth or anything like that. So I think we need to learn from other cancers first, and then perhaps do a couple of trials. So On to the other kind of diet that's cropping up quite a bit recently. So I should try intermittent fasting. So fasting in terms of weight loss, it's very popular at the moment. People have got more time on their hands and kind of trying to get healthier, staying at home, working at home more. And this is to do with interfering with the metabolism, basically. And the theory is that you could theoretically starve a tumor if you starve it of food and then eat well a couple of days a week. And there's been a couple of studies in breast cancer, but again, we can't just take what evidence there is in breast cancer and bring it over to our group of cancers. And if you think about, again, weight, trying to balance your weight, the risk actually of fasting may outweigh the potential benefits, if there were any benefits in our group of cancers. And you could actually start losing a lot of weight, and it has, it is used to lose weight with people who are overweight. So again, no evidence right now that anyone should start doing that. You may have come across people telling you that, you shouldn't have too much protein in your diet because protein feeds cancer. So it's a very old myth. I remember being told that when I was maybe 12 or 13. My uncle was ill with leukemia, and my mum said, "Oh, he's been having lots of protein shakes. He shouldn't have been having them. That's what it must have been." And actually, there's no evidence at all. I don't know where it came from, but it is a popular belief. And actually, when you look at the requirements of people when they have any kind of cancer diagnosis, the requirement for protein actually goes up quite a lot. And this is because when tumours are active and they're growing, they steal the protein from your muscle, including your heart muscle, and you lose strength, you lose muscle mass. So it's very important to actually increase protein requirements, eat more protein once you're diagnosed. So related to protein, red meat. So very popular to cut out red meat. Across most cancers, people try to eat less red meat once they're diagnosed. It's probably linked to the risk factors, so a very high red meat intake and processed meat intake is linked strongly to things like bowel cancer. We don't have an awful lot of evidence on what causes a lot of small intestinal neuroendocrine cancers, especially, or rectal cancers. We don't know. We're not clear on whether red meat is a causative factor for any kind of neuroendocrine cancer. But so we don't have any evidence to tell you to eliminate it. It's a very good source of protein, very good source of iron. Iron deficiency is very common in neuroendocrine cancer. So what we do say is that you don't need to have it every day. If you want to have red meat and you like it and you enjoy it, you don't need to cut it right out. You can have, which is the safe limits for all cancer groups, 500 grams of cooked weight red meat per week. All right. So the opposite side of things, and more extreme, is once I'm diagnosed, should I go vegan? So this again is very common for people to kind of go extreme once they're diagnosed. And I guess it's linked to a sudden feeling of, oh, my diet must have been really bad for me to get this thing. And we don't know whether any dietary factors are responsible for neuroendocrine cancer. So there's no sudden need to go vegan. It's fairly popular. It's getting more popular. And if you do choose to go vegan, then that's absolutely fine. And we will support you as dietitians and do our best to get enough protein, but getting enough protein is particularly hard because our requirements go up so much. So it's just something to bear in mind that you have to eat an awful lot of plant-based protein to get that protein in. It's much easier to have a few animal products and get that protein a lot easier. So detox. Detox will cleanse my liver and eliminate toxins from my body. So detox is very, very popular. In general, I'm not sure within the neuroendocrine cancer population, but perhaps after chemotherapy and things like that, people start thinking, I've got to get rid of all these nasty chemicals. So some people do a detox just by kind of cutting everything out that they thought was bad. So cutting out medications or cutting out alcohol, or then the next step up, I guess, is taking detox powders, detox potions and drinks and things like that. There's no research to support detoxing in any disease that I know of, even other liver conditions. Now our livers are pretty good. They are engineered to eliminate toxins. That's what they do. That's their role. I know there's been concern of when people have elevated liver function tests. So that means that the liver's starting to struggle a bit. And they want to know whether they need to cut out alcohol. Is that going to do a lot of harm? And I think it's probably best to speak to the team. So within your neuroendocrine cancer team, you could speak to the doctor or the nurse and just see what they think, whether you do need to cut out alcohol entirely, and see what drugs might be causing the elevated liver enzymes as well. So the next myth, I should take high dose vitamins and minerals as food is lacking in these days. So a few years ago, there was lots of press around our soil is overused. We have so many crops and they're, crop rotation it's such a fast turnover year to year, and the soil's just running out of nutrients. So there's not an awful lot of evidence that is true, but I guess theoretically it would make sense. Our soil, obviously, in the UK, we don't just eat UK products, we eat food from all over the world. And really, to know if this claim is true, we would have to know the soil content of every field, and we just never get to find that out, do we? So I think we have to presume there's a reasonable level still of vitamins and minerals in the food that we eat, the fresh food and fresh veg. If you're worried, then you can try and grow your own. I know this year I've tried to do that. So you know where it's coming from. But people start to take these high dose vitamins, and actually that can be risky if they are high dose. What we say is, if you want to take a multivitamin and mineral, that it can't be over 100% NRV or RDA. So that's your daily requirement. That's if you're on chemotherapy or radiotherapy. You can go a bit higher if you're not on those treatments, but really, if you're eating well, you shouldn't need anything more than 100%. And actually, during chemotherapy and radiotherapy, it is potentially harmful to have high doses of antioxidants anyway, because they may combat the effect of those therapies breaking down cancer cells and start to rebuild the cells and DNA rather than helping the treatment work properly. I need to stop eating dairy. That's certainly come via the breast cancer research. quite a while ago. It's now very outdated. I know lots of women that I see with breast cancer automatically stop dairy because it's on the internet and everyone says you can't have, maybe there's hormones in the milk from the cows, and actually there is no evidence for that. All the recent evidence for breast cancer shows that it's actually higher dairy intake and higher calcium intake is linked to reducing breast cancer. So dairy is a very good source of calcium and a little bit of protein as well. So we do want you to have dairy. If you've got a lactose intolerance, you can have lactose-free milk, and that's absolutely fine. Or alternatives, which are rice milk, soy milk, almond milk, as long as they've all got calcium added. I need to buy and eat organic. So there was some research linked to the herbicides and pesticides that are sprayed onto fruit and veg, but they didn't look at neuroendocrine cancer. This is quite a while ago, and I remember seeing studies from the Food Standards Agency who linked, I think possibly there's a link between the sprays and causing lymphomas, but it was a very weak link, and they didn't look at the link between neuroendocrine cancer. There is some people who think there may be a link between the hormone disruptors that you were so the sprays can contain things that would interrupt the hormones within an insect, and so in large quantities over a lifetime, perhaps those things could interrupt the hormones and cause neuroendocrine cancer, but we don't have any evidence of that. It's just a theory. So the Food Standards Agency did find that some fruit and veg contained higher levels and over the legal levels really that they should contain. So if you want to look at that, if you look at the Food Standards Agency, you'll be able to find out more about which fruit and veg are better to buy organic, but certainly there's no blanket rule that you should be spending more on food, because giving things a good wash usually will remove most of the residue anyway. And actually, we don't have any studies investigating people's diet before they got neuroendocrine cancer. Well, that's important to mention. So we can't say that it was a causative factor because we don't have any study that looks at anyone's diet before they're diagnosed. I need to eat the superfoods. So superfoods are those which some studies have picked out as having very high levels of antioxidants and things that can potentially cure cancer or prevent cancer if given to cells directly in the lab or mice with very high doses, and they're therefore called superfoods. It can also be linked to reducing heart disease and all these kind of things, but I don't think it's a legal term anymore. I think it's been banned, and it's basically a marketing term to sell a product. So as dietitians, if it's suitable and you can eat a wide variety of fruit and vegetables, then we try to refer it as a super diet, not a superfood. So lots of different colours. I often use the rainbow of colour in my work because it's good to have colours of vegetables and fruit throughout the rainbow. So if you are able to eat and tolerate all that fibre, then it's really good to eat a healthy diet and have all those vast colours in your diet. When I have bowel surgery, I need to follow a high fibre diet for life. So often when any kind of bowel surgery is done in hospital, you'll be given a low fibre diet sheet afterwards and kind of be sent off, and you go home and you follow it and you follow it. And then I've seen people years later come and see me and they're still following it, and actually it's not often discussed what you do and start to reintroduce, because often there's not a referral to a dietitian. So we know that intestinal adaptation can take up to 2 years. And this is the repairing of the mucosa and everything, just getting all the levels of bacteria and inflammation down. And it means that after 2 years, most people really have settled their bowels and they don't get urgency and problems with diarrhea because of the surgery. They may have diarrhea for other reasons, but after a couple of months, actually, most people can start to reintroduce fibre. And if that feels too early, then just go another couple of months low fibre and then start to reintroduce it again. And just bear in mind, if you have got syndromic diarrhea, so from VIPomas or carcinoid syndrome, fibre's not going to do much to that kind of diarrhea. The whole concept of pancreatic exocrine insufficiency, so when you have this diagnosed, it means that the enzymes in your pancreas are not being made, or there's not enough of them being made. So we prescribe Creon or Nutrizyme 22. They have to be prescribed, they're on a medical prescription, and these contain amylase and protease and lipase, and these are the enzymes that we would normally have in our pancreas breaking the food down. They come from pigs. We can't extract human ones. It would be great if we could, but they have to come from the pigs. That's the only source that we can get. However, lots of people try to avoid taking these enzymes. Over in the States, I know they're very expensive. You have to buy them, and people start to look into what they can maybe get as a vegetable alternative. Religious-wise, you're actually fine to take them whatever religion, because there is no alternative, and religious leaders have signed them off as being okay. But health food stores sell vegetable enzymes, papaya enzymes, pineapple enzymes, or just say, eat lots of pineapple and you'll be fine. But these fruit and vegetables don't contain the same enzymes, so they're not going to work as well. A papaya would have to have its own pancreas to have these enzymes, and I'm pretty sure they don't. So you have to have a prescribed enzyme, is the point. So I have to avoid all high vasoactive amine foods. So often when we give a list in a booklet or in a slide presentation of vasoactive amines, this is for the group of people that struggle with carcinoid syndrome. People say, oh, right, I'm not going to have tomatoes, I'm not going to have nuts, I'm not ever having chocolate again, and definitely no red wine. Actually, most people with carcinoid syndrome do not react to any of them, but people think that maybe it's dangerous. Probably not dangerous. Any kind of trigger of carcinoid syndrome is usually the flushing, which is vasoactive amines, but it's unlikely to be harmful. We don't have any evidence to say it definitely isn't. But only a small proportion of people are sensitive to these vasoactive amines, and the only way you can tell is by doing a food and symptom diary with a dietitian, ideally, and looking at whether you react to these things in foods. It's the aged products, so anything that's really aged and fermented. If you get a flush, especially, sometimes diarrhea, but it's usually flushing within half an hour, you may be sensitive. And so the final myth that I wanted to discuss was exercise. So lots of people think I don't need to worry about exercise as long as I look okay. So exercise is required for all-round body health. And I know from the data that I collected that you can lose muscle mass and muscle strength when you're diagnosed. So we need to keep muscles strong and big as strong as we can. As long as it's safe for you to exercise and you don't have heart problems. If you do, you need to speak to the cardiologist. But we really need to keep people strong, improve quality of life through keeping strong and active. Obviously, exercise also has benefits in terms of keeping your heart and lungs very strong. We need to keep muscles strong as well as the skeleton, keep a higher bone mineral density through stressing the bones. Obviously, mental benefits, especially at the moment. Exercise is one thing that really keeps people going. And also in terms of neuroendocrine cancer and people with bowel issues, often constipation is one of the most common problems. And exercise and moving around really gets the digestive system going. If you think about the Romans, they always had a long walk after their evening meal or every meal. So it's something that you do need to try and be active as long as the doctors are okay with it. So the next thing I wanted to talk about was, obviously I've talked so much about the missing research, and really you can see that there's vast inequalities between research, between neuroendocrine cancer and other cancers, but there's also inequality of nutritional care between hospitals and between countries, and the amount of expertise within diet, between hospitals and between countries. We are trying to bridge the gap, and there's a long paper that's been written by myself and some other dietitians to help inform everyone about the things that might be helpful in terms of nutrition and really set some guidelines so people could read it in South America or South Africa. It doesn't matter as long as they can read English. So we are trying to train more people up. Hopefully in the future, once COVID's gone away, we'll be able to do more travel and train people up properly, so patients kind of get a better standard of nutritional care. But one of the problems, obviously, is money. There's a huge gap in funding. Funding for dedicated neuroendocrine cancer dietitians is very rare, but funding of diet research is even more rare. There probably is only a couple of studies worldwide at the moment addressing cancer, and I know from speaking to patients and what I hear at conferences is that patients want more research. They want more funding to go into diet because they know it's important. However, it's really difficult. Where does the money come from? Does it lie with pharmaceuticals? Does it lie with hospitals? Does it lie within charities, patient funding? It's a really difficult thing to get funding for. So it's I think we need to think about that more and perhaps come together at some point and have a better plan of diet research, because it's just not happening at the moment. So the gaps, there are so many gaps. There's pretty much everything that still needs to be done. The kind of things that we could start looking at are what does the gut microbiome look like in someone with neuroendocrine cancer, especially small intestinal neuroendocrine cancers. We know that there are differences in the makeup of the bacteria within some patients. We don't know whether it's an effect of the cancer from an inflammation causing the bacteria to change in numbers, or whether that actually the bacteria help cause the cancer. So we need more research around that. Obviously, it's the gut and the gut bacteria is part of the immune system. So could that bacteria affect someone's immunity and kind of make you more likely to develop a cancer? Could it be implicated in the scar tissue that forms, the desmoplasia within the intestines? Would fecal transplants help? So these are feces from healthy people transplanted via a tube directly into the small bowel. Would adding different bacteria help someone? We don't know. Trialing prebiotics and probiotics. We don't have any trials for neuroendocrine cancer at the moment, so that's obviously something that would be of interest, because so many people ask about probiotics especially, and whether that would help. And certainly some people do see certain benefits in terms of reducing constipation or wind or diarrhea. Huge area which I'm particularly interested in, and did a small study in Israel, is running programs to do with diet plus exercise plus psychological support. So if you create an intervention which addresses the main needs of someone when they're living with something as a chronic disease, how much more does that help them, and how does it affect outcomes and quality of life? So there's lots of research that's required on that. Also, there's the whole area of personalised nutrition, so nutrition based on your DNA, exactly how much protein and vitamins and minerals and carbohydrates should you be having based on your cancer plus what's your DNA. We need to do proper experiments in really assessing different types of neuroendocrine cancer requirements. So a requirement for someone with a low-grade intestinal net will be different to someone with a high-grade pancreatic net, or someone that's got functioning net. We really don't know any of that at the moment, and we're kind of guessing rough guesses when we're calculating requirements for these things. There was some work to do with niacin in the Netherlands. I don't think those results are out yet, but we really need to understand more about personalising nutrition in terms of nicotinamide, so the niacin replacement for people with carcinoid syndrome. We have a rough idea of what might help someone, but we need more research, more funding to go into that area, so we know exactly how much to give that exact patient. And we need more research, not just for the more common types of neuroendocrine cancers, but we need more research for the rarer ones. So really there's nothing when it comes to insulinomas. We have ideas of how to keep people going through the night without having hypos. Powders like glycoside would have been great to run a clinical trial, but again, where does the money come from to run these things? Really, there's not much around for glucagonimas, somatostatinomas, VIPomas. It's just not something that's being funded at all. So if you need any support with your diet, you need to draw attention to it within your team. If there isn't a dietitian, you need to be asking, for some help, for someone that's trained in nutrition for neuroendocrine cancer. If you stay quiet, lots of people will know that nothing really changes. So you really need to keep asking, and hopefully over time there'll be more of a business case to get some funding. So thanks everyone. I am contactable if you need to email, but also I've got my website you can contact through, YouTube channel and Facebook. All right, take care everyone. Thanks.